Gary Bloom and I go way, way back. And when ThyCa was being created and all of the brain power that went into making this a reality, several of us contributed really towards supportive care and multidisciplinary teamwork. And several of us who was at the beginnings of ThyCa are presenting at this meeting as well. So there's a lot of us that have been so honored to be partners with Gary Bloom. And I said to him this past year how good it would be for us to do kind of a fireside chat, because although that many of us can lecture and give lots of slides and give you a lot of data that either put you to sleep or to really over impress you, we really wanted to kind of get to the nitty gritty of what is maybe on your mind and what you are experiencing or what you have experienced and you want to share with others. And we certainly, in this session, this is the first time that we actually have done this session, which opens up opportunity for you to ask any questions that you have, that you feel that we have the expertise to answer. And I'll simply, as a way of introduction, my name is Mark Chambers. I am the chairman of oral maxillofacial oncology at MD Anderson. I just celebrated my 30th year there at MD Anderson, and I have probably 10 more to give. And I have built this incredible family of partners that we work with at MD Anderson. MD Anderson is one of the largest comprehensive cancer centers in the world, as you may know. And we are, although that we are the size that we have a great connection with each other because of team dynamics. We strongly believe in team dynamics. We strongly believe in the beginnings of when patients come in from a diagnostic perspective, and then intervention perspective, and then supportive care, which is where Dr. Aponte and I, that's where we live. Dr. Aponte is one of my greatest hires at MD Anderson. Dr. Aponte turned me down 3 times to come to MD Anderson. My wife did too, by the way. So I always compare the two of them. They had something out for me, I'm sure of it. So Dr. Aponte was the chair at UAB in Birmingham, and we were able to join forces at MD Anderson, and she's been just a magnificent partner in supportive care. So her and I see a lot of patients that are on the supportive care side of business, and we have a great number of partners too that do the same. We happen to see probably most of the patients that have thyroid disease manifestations, and also other categories like leukemia, lymphoma, melanoma, myeloma. Dr. Aponte and I see a lot of those patients that have oral manifestations or complications from their therapy. So the goal setting here, I'll pass this on to Dr. Aponte to introduce herself. I wanted to share with you that within our program, there's about 40 of us that are within my my section, our section, and most of us are on the surgical side of business. And however, we also do complete rehabilitation for our patients from the oral cavity and the head and neck. And I'm so blessed to work with just some phenomenal individuals. And Dr. Aponte is certainly one of those. So, Dr. Aponte, you want to introduce yourself?
Yes, thank you. Thank you for having me here. I come from Venezuela, from South America, from a little town called Mérida, up in the mountains. So that's where I come from. But I've been blessed to be here in the United States for 28 years. So this is my home too. Well, 9-10 years ago, I moved over to MD Anderson, and that's where I've been stationed, all these years. And like Dr. Chambers said, we collaborate greatly with all the different services from the the whole hospital. And so we troubleshoot all these different, you know, things that the patients come, you know, to us with. And so, yeah, this is our thing, you know, to try to help mitigate, you know, what happens after cancer therapy. So, yeah. So if you have any questions, please, please, please.
You know, we have a huge database that has been happening for 50 years. So long before I came on to MD Anderson, we had this database that showed dosing, treatment parameters, and a great amount of those that have the most complications are usually in that area of 125 to 150. However, you will see a spectrum, and you can certainly see, even for patients that have radiation treatment that is external beam with very low dosing, to have even more prominent problems than those that have full course of external beam radiation treatment. So we're also built differently, aren't we? And it could take months before you actually see some ductal tissue challenge or compromise. And you worked through it somehow with stimulation, probably, and some kind of compression.
Yeah, and it became less of they would swell from time to time, and they really, it's really not an issue, but my mouth is drier and way. Now I've had, as a younger, I'm 66 years old. As a younger, I had larger fillings put in, cracks, crowns, all this stuff. So now those teeth are breaking. I'm going on my 4th implant. So I had 2 done prior to any my iodine. Yes, 1 year ago, and at this time, I'm done with 2 cracks. So I'm assuming it's part of my dental. Also, I'm really concerned.
Yeah, exactly. So it can be so problematic with when you diminish some of the molecules in your saliva, and you don't have the properties of what we call remineralization for the enamel. I was thinking, as soon as you started telling me that, of what the benefit would be of adding probiotics to your life, to have, as an example, Chobani yogurt that has some of the most magnificent probiotics to help in regulation of the oral cavity. We call it the oral ecology. And it is so wonderful to see what that could actually do for remineralization for your mouth. Yeah, we like the idea that you see a salivary specialist. There are so many in the United States, and that you get tested for your composition and to see if there is changes that are very strongly in one area or another that seems to be causing more periodontal issues. We have found a great deal of evidence of on the microbial side of when you start to see teeth crumbling, and when you start to see more caries, more bacteria-driven caries, that the oral ecology can be part of the problem. Now, the other I don't want to diminish is also with regards to circulation. Circulatory challenges also just in the jaws as we get older can also be a part of the problem. However, 131 can also impact circulation, and particularly circulation to your glandular tissue and soft tissues. So I don't want to forget that. And I think an equilibration of the mouth can really be very, very beneficial. So many general dentists don't necessarily think of the infrastructure either. Not to be a Debbie Downer, so to speak, on our general dentist, but I do have to say that many that would go and see any of us that have teeth crumbling and have sensitivity, they'll think of an elaborate plan that may require teeth extractions or endodontics and crowns being added. And before you know it, it's $50,000. Or before you know it, it's $5,000. or before you know it, it's $1,000. And I personally believe in a strategy of looking at the infrastructure of why are we in the condition that we're in. Dr. Aponte?
So to further your question, in regards of the output sometimes of saliva, it's sometimes you can also have like nuclear medicine evaluate you to have like an examination of the output of the gland. So if you have a reasonable amount of output, you can also then start like medication, like cevimeline or the pilocarpine or something to that nature, to where it will stimulate further. But I wouldn't like suggest that from the get-go unless you have that nuclear medicine evaluation, because they really help us. That's how we normally work on these problems for patients. The other is, I was telling our friend over there about Prevident 5000 Plus. That's a toothpaste that is from Colgate. It is prescription, but it is very nice because it has calcium and it has phosphate, which are two elements that normally saliva has. But when you are depleted from those essential elements, then the mineralization of the teeth is diminished. And so if you re-infuse in your mouth, alkalinization, like I said in the other talk, with the baking soda and water, plus the Prevident 5000 with calcium and phosphate, I think you do much better. Well, so this is how I tell my patients. Depending on the dryness, you may do it once or twice a day, but I also want them to use their everyday toothpaste in between meals. So here the key is to brush more often. Not only just with the medicated toothpaste, but with your own every day that you were used to. So that's how I advocate. Yeah, it's almost like your mouth is your hobby.
Yeah, it feels that way. Feels that way indeed. It feels that way indeed.
Yeah.
I look at dry mouth and think about what can I do that won't overwhelm my daily regime. I'm getting older. I take 10 tablets a day. I now have medicine dividers to put my medicines in. Now I go to a dentist. The dentist now puts me on a prescription for enhancement, maybe 2, possibly 3. Now I see my endocrinologist. We're now considering something for bone enhancement. Now I see my surgeon or a longitudinal clinic for survivorship, and there's other medicines we can add. It's so cyclical. We think about it very strongly in oncology because we prescribe a lot of medicines. And some of the medicines that we give counteract some of the others, and there's drug-to-drug interactions sometimes that make it even worse. So there is a fine line. We want to go very basic as much as we can, and we want to stimulate how we can increase function without having to add a pharmacotherapeutic. We want to stimulate and we want to balance the bacterial overgrowth and fungal overgrowth and virus to help. So I want to share about the kind of a simplistic approach to that. Simplistic approach in looking at the foundation is when you go and you seek out a medical dentist, a dentist who is either a hospital dentist or a prosthodontist, a maxillofacial prosthodontist, an oral medicine specialist, and or an oral maxillofacial surgeon. And you have your beginnings of being diagnosed with thyroid cancer. And you don't even consider a dental element to all of the other stressors that are on your plate. So you have so much to deal with regards to endocrinology, to surgeons, medical oncology, radiation oncologists. Now we're going to, in the supportive care for many of the comprehensive cancer centers or comprehensive programs, we're going to add an oral specialist as well. Now we also, for more challenged thyroid disease, we're probably going to bring in also a speech therapist, a speech and language therapist. So now we have all of that happening, and we also have a dental visit. We highly advocate in comprehensive cancer centers for you to see a specialist, an oral specialist who we hope is going to have a common sense approach to how to improve your life in the mouth department sensibly as you go through the initial phase of treatment. And then thinking about what happens longitudinally when you then go to aftercare. And now we start to think about survivorship. And we think about what products, what techniques, what can actually be given to enhance and return some normality to your ability to swallow, chew, taste, swallow in general. Reflux is a big problem that many of our thyroid patients also suffer with. And so we have to think about that as well. That's a nuance probably in the last 15 years that we are also including a great number of proton pump inhibitors at a very low dose at the beginnings of treatments so that we can help to also regulate acidity that can be so harmful to the GI tract during into the teeth. Exactly. Precisely. So where I'm driving all that home is simply to say that long drawn out comment I just made was principally to tell you that the mouth is so important. We realize you have a lot on your plate. We want to do a simplistic approach. We want to try to reduce contamination in the mouth. We typically put you on an antimicrobial toothpaste, and then we are going to alkalinize the mouth. We're going to alkalinize the mouth by alkaline type products. Some of that may be that you're going to enhance water. You may be increasing tea in your life. You may be drinking aloe vera water. You should stay away, particularly after therapy, or at least approaching radioactive iodine treatment, to stay away from any heavy caffeine. We want to stay away from caffeine. And we also want to stay away from heavy sugar products during the time of introduction. Now, that's something you can get back to, but it's something at the beginnings has shown evidence of overtaxing glands. And you don't want to overtax a gland with making it in a hyper state. And that's what caffeine will do, particularly when you start to dry in the oral cavity. Simplicity, it's so important. More questions, more comments. Right. So there on the American Dental Association, there is on their website, find a general dentist. And when you go and look for find a general dentist and you look at that search engine, you're going to want to talk about various things that you're interested in. That would be dry mouth, or it would be bleeding gums, or it would be, that's how you can see subspecialists. Now, I also very strongly advocate for oral medicine specialists from the AAOM, the American Association of Oral Medicine. They also have a find engine. And so does the ACP, the American College of Prosthodontists. You can do the same thing there. And then lastly, the AAMP, which is the American Academy of Maxillofacial Prosthodontics. They also have a search engine that you can use to find in your community. We in oral maxillofacial, there are a considerable number that cross over not only surgery, but also prosthodontics and also in oral medicine.
I have a question from Zoom.
Perfect.
Do any of the products recommended, such as high fluoride dentrifices or fluoride trays, xylitol lozenges, or any treatments for that a dentist might use in office, do these contain iodine or carrageenans that could interfere with RAI uptake?
Yeah, that's a great question. And that has been studied quite substantially about iodine containing products. Most of that which we have been advocating do not. And we have provided a great deal of toxicology, particularly in sodium fluoride research and stannous fluoride research. And we promote it because we feel it's a product that has safety. There are some naysayers. There are naysayers, I will call it, that look at some bad advertisement for fluoride. And we have been strong advocates because of that which much has been against fluoride is usually a byproduct of what there's a research that has occurred over the last many years that is on stannous fluoride particularly. And stannous fluoride is also used in fertilizer. And that is it has a very challenged toxic profile. And so many times medicinal stannous fluoride and fertilizer stannous fluoride get combined. And so naysayers, I'll just group it that way, will end up saying how toxic it can be and will not use it. We then say, okay, let's go and neutralize then your oral cavity. And we're going to go with either calcium and phosphate through a product called MI paste, or we will use sodium fluoride. And we take toxicology and tumor protection science very serious at MD Anderson. And so we have to put a seal of approval on it before we would advocate it. So that's how I would answer that particular question without getting into the weeds. But whoever sent that or that chat, which is so beautiful, that question, I have some good papers that I could send you if you reach out to me that would give great persuasion of the medicinal quality and the toxicologic profile of it, of many of the products that we've talked about today. Please. Of course.
We broke the rule for Carol's question.
Oh. Hi. I had a question about salivary acupuncture. I didn't sit in on your talk, so I was curious about if there is a resource for people to find acupuncturists that do help with stimulating salivary function post-RAI. And then I also wanted to know if you have any research about the probiotics for the oral cavity. I'd love to present it to my doctor. I'm a hygienist, and I'd like to be able to kind of stoke the fire with him on this one, because we've gone back and forth about it time and time again. So if you can answer those questions, that would be great.
Yeah. I'll start off with the acupuncture. Okay. The acupuncture is something that I have had great interest in over many years. And I was a very strong doubting Thomas of its benefit until I brought to our institution Dr. Nipchow. And we, to take a very long story to make it less than a few seconds, Dr. Nipchow is a world authority on acupuncture. And he made strong believers out of us at MD Anderson about 25 years ago, when we were still having conferences where patients would be in the middle of the room and we would be in an amphitheater around the patient and present patients that way. And we brought a patient in at my request who was a farmer outside of Houston and was very, very dry. And I knew that if it did not work for him, that it was not going to be something we would advocate. And I knew that if it did work for him, we were really going to be onto something. And with my own eyes and with my partners who also have doubted alternative medicines, within our practice, we were believers for this one particular patient. So we did research. We started a great deal of research. We probably have done, I would say, $25 million worth of research within IDCR, NIH, and NCI. We've probably have gotten 50 plus publications on it. We have in the thousands in our database. We use what is called the 13 points of NIPSHOW, NIEMTZOW, the 13 points of NIPSHOW. And the 13 points of NIPSHOW have shown with giving it twice weekly with about a 20-minute application and doing it twice weekly can enhance salivary function, even for those that have almost minuscule amounts of saliva. The American Board of Oriental Medicine is where you can find master acupuncturists. There's also a board for them called the American Board of Medical Specialties that you also can find. Their search engine is not so easy to get through, but you can look for it. If you send me a note, I will send it to a renowned acupuncturist that is within our group at MD Anderson. We have what is called the Place of Wellness, and we strongly have integrated medicine at our institution. And so we have a master acupuncturist there that I could get you in contact with. And we certainly could ask her what she thinks in your area, who would be that individual who is in our network. And your second question was about probiotics. There's many research papers that will speak to good bacteria, feeding good bacteria. Did you know we had a good bacteria and a bad bacteria? Which side do you want to be on? You want to be on the side of good bacteria, and probiotics can certainly help in that manner. Ruth?
So with the probiotics, I think there's so many, right? There's so many brands. And so what do you choose? What do you select? And I think that, I don't have the answer to that other than, whatever suits your needs, right? You can start with something very simple and then maybe increase it in billions, because they come in different units, I guess, is the better number. So depending on, how you do, you can, manipulate that. But certainly I think, it's been proven that, it helps to have, if you have good, gut bacteria, I think the rest kind of comes all together. And it's used not only just for the mouth, but for other illnesses in the body. And so I do feel like there is a good correlation between, that healthy gut and the rest. Yeah.
Our partners in internal medicine, as an example, so every one of a patient, before I take a patient to the operating room, if I'm going to do oral surgical procedures, I will put every patient through what we call a perioperative risk assessment so that I can feel confident that the patient doesn't have something else that I haven't seen. I would do a considerable amount of testing. That's what you would expect of us at MD Anderson. And we do. We perform in that manner. Probiotics is something that my partners in internal medicine use also very strongly for tobacco users. Tobacco users that we're about to do a very strong surgical procedure, we will come close to begging a patient to stop smoking. And we will do probiotics for about 2 weeks before a surgical procedure. And we show the data. It is astounding to see how you heal. What happens to your healing cascades when you stop tobacco and you encourage new wound healing through numerous cascades that in principally fibroblasts and enhancing other molecules that can really be so beneficial. If a person can stop tobacco, enhance their lives by probiotics, we have shown recovery. We've also shown on those patients about progression-free survival, about cancer survivorship. It's pretty impressive. We're at the advent of that too, by the way. We're at such the advent of our knowledge in probiotics. Please, of course, be a great question.
So trying to figure out where to start with this one. We have kind of a two-part. One is the medical part and the other is the financial and insurance part, closely intertwined. So a long-term survivor of thyroid cancer, RAI treatment, implants are being suggested now because the teeth are deteriorating and falling out literally. But that's a expensive option to begin with, but also, you know, when do you decide to do implants versus just dentures? If there's some question about the jaw itself, will implants even be practical? I wondered what your thoughts were on that. And then of course, the coverage from the medical insurance side. How do we mostly go into these appointments talking about dental insurance coverage. Most of the doctors, dentists aren't familiar with the cause of the problem being medical. How do we get medical insurance coverage for this?
Precisely. I know Dr. Aponte, you will definitely want to hear from her. She is one of our implant specialists within our service. So I know she'll have something to say about that. I, as a chair, will tell you that we, in comprehensive cancer centers in the world, particularly in the United States for third-party payer, we strongly defend benefit of medical-driven decision-making in our practice. So we, for the majority of what we do within our service, is medically covered. In comprehensive cancer centers in the United States, most of what you will use for oral rehabilitation will be on the medical side, not the dental. So medical, so MD Anderson, Memorial Sloan Kettering, Mayo Clinic, Johns Hopkins, Yale, Stanford, Cleveland Clinic, Case Western, I could keep going. There is a lot of comprehensive cancer centers, right? Right, comprehensive cancer centers. And you have them here in Denver also. NCI designated comprehensive cancer centers. All of the HCG sponsored programs in the United States, most of them have very strong oncology programs, are also designated as comprehensive cancer treatment. So that's where you start. If it is that you strongly believe that your demise in the oral cavity is secondary to treatment, many times it is, and you then have an evaluation from an oral specialist, an oral oncologist, that is the beginnings of helping you to be able to manage cost with regards to on the medical side. Implants, I have a very strong belief in the fact that if we believe the infrastructure of the oral cavity is weak or is compromised by radiation treatment and high enough with regards to millicuries of 131, let's say over 300, I would say I frown on putting implants into the oral cavity. I've seen such a demise for bone necrosis, and you do get osteonecrosis from radioactive iodine. It is a misnomer that is only from external beam radiation treatment. That is a misnomer. Now, some people in my specialty will also cross it over to osteonecrosis, where they actually believe it is targeted therapy induced bone necrosis. So just for, again, having a better appreciation of where you've come from and the treatment that you've had. Dr. Aponte?
In terms of, the billing part of it, right? Sometimes what needs to happen is you need to have like a medical necessity for this procedure they're proposing for you. And more likely marrying it with your diagnoses. And so if this is, obviously caused by the the treatment for your thyroid, right? Your mouth is deteriorating, whatnot. So that medical necessity should be geared in that way. And so by virtue of that, then maybe the medical part will take over instead of the dental part. Does that make sense?
I do want to tell you that that if you can find a general dentist who is a Medicare provider, you're home free, because they're going to use substantially your medical insurance, and they're going to be able to defend it, and they're recognized by Medicare, Medicaid, and third-party payers. And so that is where the problem begins. Most general dentists are not Medicare providers because they are not geared in their practice to see medically compromised patients. And sometimes that's probably a good thing, that you're not seeing someone who may be apprehensive of seeing a cancer survivor. We can blame Lyndon B. Johnson for his staff for that. I can boldly say that, being a Texan. And I bring that up because when he signed the Medicare Act, cardiology and dentistry were the lowest on the totem pole of reimbursement. And that is the reason that most dental insurance plans only have a cap of about $1,500, because of the fact that our lobbyists were so awful in Capitol Hill when he was president and signed the Medicare Act. Cardiology and our discipline did not get a proper reimbursement. And it is an abomination of what is reimbursed on the dental side. So to your point, that is very true. You need to find a Medicare provider dentist. And you can find that, by the way. You can find that because of how they advertise. They advertise that way. And you can, you have to advertise. If you're advertising as a general dentist, you will advertise what walks through your door. And most will say something to the effect that dental insurance accepted. Some will say walk-ins accepted. And somewhere in that area where that is, where that proclamation is, you usually will find them to say whether they are or not a Medicare or Medicaid provider. Something to think about when you're trying to call a general dentist's office, by the way, and make an appointment. I'm on the phone and I'm trying to get that appointment. I don't want to shy away from that, because I don't want to be surprised when I get there and I have to pay $500 to get into the front door. I wanted to ask them right then and there, are you a Medicare provider, and do you accept medical insurance for the initial exam? How about the implants?
Oh, for the implants, well, there's many different treatment plans. It could be a single unit implant, or it can be for an overdenture. It could be just starting with 2, or depending on the complexity, you could have 6 or 5. It just depends on the case. So if you're going to be like edentulous, right? So it can be interesting, because you can have many different plans depending on, the finances and what the structure of your, maxilla and mandible would be. So I think the idea of seeing somebody that, like Dr. Chambers was saying, like a specialist, right, that can create like a very nice comprehensive plan for you is of your better interest, versus doing a little bit here, a little bit there, a little bit. So like that, you would have like a bigger picture of what can be offered to you. That's what I would say.
Yeah, we've proven
Yeah.
in our facility, we've proven what iodine 131 can do to the mouth, and what it can do to the health of the head and neck. And because of it, that's strong in our support documentation when we do medical necessity notes. The other thing I wanted to share was that taking teeth out, like the old VA medical center philosophy, no teeth, no problem, that is not the way to go. And I frown on that very strongly, about taking out teeth that still have much service left. And so that's also something that needs to be clearly discussed one-on-one with your dental specialist. Other comments?
We do have another question from Zoom,
Perfect.
and I'm going to bring in John. Hopefully this works.
Okay.
Hi, John. Can you hear me?
I can hear you.
Okay, go ahead.
Okay. Hi. Thank you so much for what you are doing. I heard your earlier session too. And also had to type my question. I don't know if y'all can see those or not, but I had written some of it out. But basically about 4 years ago, I had 40 external beam radiation treatments done in 20 days after for ATC. And then just last year, in my lower back jaw, I had some teeth crack one after another and had them crowned. And I guess I was just wondering generally, you know, for a few years, I really had no problem, you know, 2.5 or 3 years. And now I've had that and my teeth, I'm having more problems with my teeth, which I've never had before. So I was just curious, anything else other than what you've already recommended about preventative? And then also, I guess, just curious the probability that I'm probably going to continue, if this is a long-term continuation, probably as I'm 63 years old, and I don't know if I'm going to be dealing with cracked teeth and what can I do to maybe prevent it? Thank you.
That is a great question. And you had some very tough disease, my dear. So that is tough business, which you have been dealing with. So I have to say that we don't look at every patient in a cookie cutter approach. We individualize and package what we believe is most applicable for a patient, because I'm going to look at not only the oral cavity, I have to look at the whole picture. I need to know what medicines patients are on, what's their medical conditions. I want to know about other habits, and that helps me to influence a package for you. I want to start with infrastructure, and then I want to help regulate some of the challenges that you are encountering. And so that, again, is a reason to consider a specialist, to have a comprehensive plan.
Yes, I agree. And of course, zeroed into the equation should be the dose of radiation you received and to what structures of the head and neck, because that would also influence the decision of can we extract teeth or should we not extract teeth. And so then that brings another conundrum of decisions, for your safety. So yeah, it's a little complex, your question, but very valid, of course.
Can I follow up?
Absolutely.
Okay, all I was going to say is I did kind of coordinate back and forth when I had my work done by a local dentist, but I've had all of my treatment all the way from initially at MD Anderson. And I still go to treatment because I have mantle cell lymphoma too. and I'm in a clinical trial for that. So I come constantly there anyway, but I didn't realize that until going over the agenda here that, you all existed, the dental at MD Anderson. So
Exactly.
So I might be making an appointment with you guys.
We would love to see you. We would love to see you. And we can certainly help to give you our opinion. And I hope that you will look us up. We certainly would give you what we can possibly provide that would help your life. The circulation of the jaw after external beam radiation treatment is extremely important to us in how we can help dentition. Poorer circulation to the mouth, to the tongue, the floor of the mouth, the dentition, the jaws, tori, these extra bumps that you have in and on your jaws. By depleting circulation from a cancer treatment or medicines that you may be taking, can leave a much unhealthier oral cavity. And so enhancing circulation by multiple ways of what we've discussed. Something I'll throw in as well is treatments that are with pentoxifylline and tocopherol therapy, which is on the market known as Trintol and vitamin E therapy. Vitamin E, I do not like to use up to about 1 year after treatment because we frown on fat soluble vitamins immediately during cancer treatment and thereafter. We traditionally 1 year thereafter, when we see that you have no evidence of disease, we traditionally will consider it also to enhance circulation to the upper jaw, the maxilla, or the lower jaw, the mandible. And many times patients who start having these crumbling impacts of teeth falling apart and disintegrating, enhancing circulation can give a pretty sizable outcome to give you greater health to the dentition. So Trintol and vitamin E, Trintol is on the market for a condition that we call claudication. It's also used for restless leg syndromes. It's also used for when you have very bad circulation in the ankles, the feet, the fingers. So end organ or end of a limb can greatly be enhanced by Trintol. It's been shown now for 30 years that it benefits our patients also who have challenges that are disintegration of the mouth. And so we pull it out. But we first do a perioperative risk assessment. We do an internal medicine review because it is a mild blood thinner. And we want to make sure that an individual can withstand it. And so that's when we bring in our internists. Other comments? Those are great questions, by the way. Please come see us.
So I've had the anaplastic thyroid cancer, had the external beam radiation, and lived much longer than what they had anticipated. So now I'm dealing with things in the mouth. And what the doctor, you said what type of salivatory?
Salicox?
No, what was the doctor?
Salidonoscopy?
Yes.
Right, Dr. Stephen Lai, L-A-I.
LAI.
Right.
He'd be
He's
the one.
world famous for salidonoscopy. Right?
Okay.
Right.
That's what
Yeah,
I
that would be fabulous. Bless your heart, may I add. So I'm so glad you're here and sharing with us. I'm sure we all could learn from you also of what you have gone through. And so Stephen has contributed so substantially to our knowledge of how to enhance salivary function mechanically. We look at it more from a medicine standpoint or a stimulatory standpoint. Now, one of our leaders in thyroid on the surgical side, his name is Mark Safario. And Mark is here also. He'll be presenting tomorrow. And he's also a world famous leader in anaplastic disease and thyroid disease, generally speaking. His partner, Maria Cabanillas, is going to also be giving a presentation, I believe, at your dinner tomorrow night. And she is fabulous. We all care so much for her and very approachable and someone I think that if you ever want to get a second opinion, if there is ever a need for a second opinion for thyroid disease, she would be who I'd be going to. She's really amazing. Thank you so much. Other comments?
We're going to bring in Peggy on Zoom. Peggy, if you can hear me, go ahead.
I'm here. Hi, Dr. Chambers and Dr. Aponte. Thank you for being here and doing this. To kind of follow up with some of the questions you've already addressed, I'm a 20+ year thyroid cancer survivor, approximately a little over 250 millicuries with 2 different treatments. I've had or experiencing over the years, especially later, a lot more dental oral issues. I've done with my local dentist pretty much all the things that you've suggested. I do have the dry mouth, but the biggest problem I am experiencing is very sensitive teeth to the point where they actually almost just ache, even if I'm not eating or drinking anything. I've tried prescription toothpaste. I don't know if it's an enamel issue, but just really severe sensitivity to cold, to sugar, to hot. I mean, I have to almost drink everything from a straw because if things hit my teeth, it just sends me through the ceiling.
Yeah, and that is a signal of dry mouth. When you have pronounced salivary dysfunction, it goes hand in hand with hypersensitivity of the teeth to a stage that when you lay flat, that if you concentrate just strong enough, you probably can feel a heartbeat in your teeth. And so we have patients that come all over the world to see us for hypersensitivity. And hypersensitivity also can go hand in hand with burning mouth syndrome. And so there are some neuropathies that actually do develop that lead you to having this hypersensitivity. We start off usually with trying to increase the moisture in your mouth, but we also have had really magnificent luck with 5% sodium fluoride varnish that can also be placed, and it's very minor application to the teeth, and it can greatly enhance a drying impact that happens on the enamel and the dentin. 5% sodium fluoride varnish is applied typically by way of a dental hygienist, and they'll paint that, and it's an application you can get about every 3 months, and it has been shown to be very beneficial. Two other things, and I'm sure Dr. Aponte has others. Botox has actually also been used in this manner. And we have found an application of Botox around the gingival tissues that have also been beneficial for patients who have this very strong hypersensitivity. The other element is by way of our calcium and our phosphate that we've been introducing to all of us today. And that can also be applied in a thicker manner where you don't mix it so richly with and dilute it, where you actually make almost a paste with the calcium and the phosphate, and you apply it over your dentition at nighttime before bed rest. It can be beneficial also. And what we're trying to do is obliterate these small little micro openings into the enamel so that these nerve endings, which are very small but very painful when overstimulated, they need to be obliterated. And that's what this can do. Dr. Aponte?
So there's also another toothpaste that is from Colgate as well. And it's for sensitive teeth. And that one, the composition is, it has potassium nitrate, which also goes into those little tubules and it kind of seals them off. And then the sensitivity diminishes. So that's, it's called, I think, Prevident 5000 for sensitive teeth.
I've actually used that. I'm actually currently using that. I've got several prescription toothpastes that I'm currently using that really just don't even seem to be touching it. And the only thing my dentist has prescribed is they're suggesting that I come in every 3 months for just regular fluoride applications.
Yeah,
Yes.
that can be painful also, may I add.
It is.
Used to it. And
Yeah.
it's almost like
It's like,
all of us when
yeah.
we were 5, 6, 7 years old and we were in our first year of school. And some of you may remember when fluoridation first started and you all had the fluoride treatment, the dreaded fluoride treatment in school. And you would put this fluoride against your teeth and everyone was shocked because how cold it was and it stimulated so strongly these nerve endings. I think the sodium fluoride varnish is kinder to the mouth, and I think that it is easy to apply and warming to the teeth. So something to think about. But thank you for the question. Great one indeed.
Thank
Other
you.
comments? You're welcome.
Phosphate something you can get over the counter, or is it a prescription?
It's over the counter, and actually one of the products that's in these little sachets that you can put in your pocket or purse, it is called Saliva Max, and it comes out of a company right outside of Houston. And so if you do their website, Saliva Max, we promote them, and we do feel it's a very strong, stable product. And you can put you open the sachet, you put it in a little bit of water to reconstitute it. You can add less of the water. You can use it as a paste.
Let's squeeze one last question in.
Yeah, please do.
For those of us who are not as fortunate to have a doctor or dentist like you, who are aware of the post-REI dental issues, how does one get proper care? I really like my dentist, but she gave me a deer in the headlights look when I mentioned REI to her.
Yeah. What a wonderful question. I think that it is, you're right. There are 50 times more general dentists than there are oral specialists. And I think that it's important for you to help educate your general dentist as well in letting them know what you've gone through and also some of the experiences that you've had. I think that generally speaking, keeping the mouth very clean and neutralized can be a big plus. Keeping your mouth clean, trying to fight the temptation to eat sugar right before going to bed, and also salt products can really change a life. Sucrose is a magnificent food source for multiple bacterias that are harmful bacterias that can also contribute to GERD, to reflux disease. And so flushing your system and trying your best to not eat at least an hour before a meal, before rest, bed rest, can influence your life so dramatically. Most of us in life do not have the energy to do a second brushing in life. We brush our teeth one time and we don't get around to doing the second brushing. Most of us in life are so busy or too exhausted that we don't allow it to be part of our regime. We have proof of what occurs in the mouth if you can brush your teeth twice a day. And if you can brush your teeth before bed rest, you are going to see a surprising change. The other is the fact that so many of us also do not do a very good job of flossing. And although you hear it so strongly by your general dentist and your dentists about the fact that you need to brush your teeth, you need to floss, and you should brush at least 2 to 3 times daily. I like, again, a very common sense approach to that. I believe so strongly that if you can keep your mouth clean, if you can reduce acidity after 8 o'clock before going to bed, if you're one that goes to bed before 11, it is so good for the body to be neutralized for a few hours before you have bed rest. It's good for so many of your systems. It's extremely good for the mouth. So even if I don't have a general dentist or I don't have the cash flow to be able to see a general dentist, keeping your mouth clean and alkalinizing your mouth with either sodium bicarbonate or a saltwater rinse is so good for the upper aerodigestive tract. It's a benefit. We've proven it. Oh, mama's recipe is salt and soda. It works. That's why when every one of us get a sore throat, one of the things you think of, salt water. Let's salt water our mouths. How many of you do that? All of us do, every one of us. When you have a sore throat, it does do magic. It's astounding to see what it will do to destroy a great deal of bacteria. Neutralizing the oral cavity with sodium Arm & Hammer baking soda before bed rest is a very good adjunct. I keep that by my sink, and I strongly advocate that to our patients. And so what I don't particularly care about is using very strong alcohol and phenol containing mouthwashes before bed rest. So if you use something like strong Listerine in the brown bottle or the brown solution, and you put it in and you swish, and all of a sudden tears are coming up and you are burning that soft tissue, you think it's so good. It has to be good because I get this burning sensation. It's actually cauterizing your soft tissue. It can put you in a very bad state of affairs. We're highly against alcohol-containing mouthwashes. Now, I will tell you that one of the products that Dr. Aponte brought up also today, the chlorhexidines, we do like also, but we don't particularly care what's on the market right now that has alcohol in it. And it dries the mouth out even further. So it happens to be that the alcohol-free product was taken off the market because it started to grow bacteria and they could no longer allow it to stay on the shelves. So it was taken off. It still does not have a good substitute. even though in England, or sorry, in Europe they do. You have any other comments on that topic?
Like Listerine, that you brought it up, they have a product that is Listerine Zero, so it has no alcohol. So if you still like to do the Listerine without the
Cheers.
the tears, then you can do the Listerine Zero, because that one is very nice. Also, Crest has another one that is without alcohol too. It's blue. I can't remember the name of it, but Pro Health.
that's
Okay. And ACT for children, it has fluoride, and that's pretty good too.
So, do you have any other suggestions?
Well, I was just going to say,
Mhm.
it's a bit of a bane of my existence because it increases tartar
And stain, yes.
So for people who have hypersensitivity, if their dentists or hygienists have topical anesthetic that they can put prior to scaling, people request that. Lidocaine and Orifix are two names.
Yeah, perfect. Excellent.
Along with alkalizing your mouth, or keeping the pH low or high. Would like alkaline water, like sipping alkaline water, or like rinsing kind of after meals and stuff
It's
when
very good.
you can't brush.
Of course, it can go the opposite direction too, can't it? It is, if you're too alkaline, it could also cause some adversity. So you really want to be in that neutral zone. And so sticking in that neutral zone is a really good idea.
So using not too strong of alkaline, like
Precisely.
if you add sodium bicarbonate or
Exactly.
baking soda, just like
A little pinch
only
of
as
salt.
much as you need.
A little pinch of salt is quite good. Yeah.
What about I have a Crystal Light habit instead of a soda habit, which probably does me a little favor, but it's always very acidic, a lot of citric acid. It would benefit to like neutralize that maybe a bit with baking soda.
Advocate water and to add lemon, fresh lemon to it, and to try to turn that Crystal Light into a habit that you're actually doing lemon water, but you're squeezing actually a lemon into it. That's actually quite good for you. And having too much acidity, of course, is going to upset your vocal cord also, because you'll probably get a little bit of residual that will hit right over that in the airway with a little bit of aspiration that many of us do have. That can actually be too acidic to the digestive tract.
Yeah, especially after the neck dissection.
Exactly.
I swallow wrong.
Right, exactly.
A lot more.
Right, that will improve. That will definitely improve. It should anyway. And that's where the speech pathology partners really need to come into play.
Yeah, thank you.
No, thank you. It's a great question.
Does it matter when you said aloe water? Does it matter if it's flavored aloe water, or should it just be like?
Yeah, most of the aloe waters that are used at most of the cancer centers are actually non-flavored. So that's what I traditionally advocate, is a non-flavored aloe vera. Put ice in it, and you can put even a lemon or a lime wedge in it. Excellent.
Also, we live on an acreage, and our well water, we don't have fluoride, so we don't drink fluoride water. But we have a lot of manganese, in our water. Does that have any effect?
That probably could have some adversity to the enamel and how it would be picked up in enamel, particularly in youth. In children, that probably would be picked up a little stronger in the enamel. And I'm not real sure about what its long-term effect would be. You may be also needing to alternate a little bit with some bottled water or some, I think that if you're getting some exposure to that, you're probably getting just perfect balance. I prefer to do softeners, to actually add softeners to our wells. I live on a farm also, and we have well water as well, and we will soften the water, right? Oh yeah, beautiful. Oh yeah, you must be doing everything just so wonderful there. Yeah, that's awesome. That's awesome. Right, that filters out a lot of nasties.
Yeah.
Okay, everybody, we have gone over our limit, and we appreciate your time.
Right, you bet. We did a little beta test on this just to see what it was going to do. And I think that in the future, we will do more just meet the professor type of discussions, because it's so wonderful to be out with you and to have one-on-one. We are not leaving this meeting and not going to exchange with you. If you have any interest in having further dialogue, discussion, or you want to come to visit us, please feel free to reach out and we will make that happen. And we want to improve your lives the best we can. And so I know I speak on behalf of, again, all my partners. And I know Dr. Aponte and I are very appreciative to be part of this. And thank you for staying over. And we look forward to more exchange. And please exchange with us. We will tell you what we think and tell you like it is in our world. So thanks, everybody. Thank you.
Thanks, everybody.